Are there any nurses in the room at all? Yay! Awesome. That's really good. So I'm really nervous because I'm presenting on something that is still in the works, and I haven't presented in a really long time, so I might not be good at it. And also, this is a topic area that is progressing and new to me. So I don't know, sometimes I might feel like a bit of a sham talking about it. So my topic is Queer and Canadian Bachelor of Nursing Curricular Policy. Where's the LBGTIQ2S core competencies? It started as a master's thesis, and basically it's focused on why education is really important to affect policy change, and because healthcare providers may or may not provide good care based on a lack of education. And in Canada, there hasn't been any research done on nursing curriculum to see if there is any sexuality, gender identity components included in it. So that's what I did for my master's research. So I used queer theory and focused on systems level analysis, public health policy, to look at whether or not there's institutionalized heterosexism and cisgenderism in nursing curriculum policy, and some responses from nurse educators about it. And my master's thesis is in applied health services research, which is kind of a new field that develops and utilizes research for the betterment of health services. Most of it focuses on economics, informatics, and health technology assessments, but it can also be used to improve the outcomes of care services, delivery and quality, and then ultimately affect the care that is provided to people who are in need. It's also, I used a lot of document analysis as well as interviews to come up with the data. And I'll get into it more, but I think it's really important to use KTE, which is knowledge, translation, and exchange, as well as action-oriented research. My data is from a couple of years ago, and while I was collecting the data from the surveys, there was several changes to the licensing exams across Canada, so it may have influenced the results a bit, but probably not much. So healthcare curriculum, in Canada, medical curriculum's really heavily standardized. Nursing curriculum is a lot less standardized. Also, by looking at the curriculum policies, it helps identify what gets taught and why it gets taught to see whether or not there is actually any queer health and wellness in it, if not where it could be, and what should be there. So for my research, I looked at the quality of information that was in baccalaureate nursing programs and policies, and I also reported on the queerness of the English language only for the entry to practice stuff, surveyed administrators, and developed a comprehensive list of sexuality, gender identity, health and wellness issues, available curriculum policy resources, and also came up with a dictionary of LBGT terms. So there's a couple other points on this slide. So TWU, which is Trinity Western University, has a law school that they're putting forward. They also have a nursing school. So after my research, I was following the law school because it was they were getting denied the access to the law school based on a community covenant saying that, because it's a highly religious university. And so what I did was followed all that to see how they were addressing the law school issue, because they also have a nursing school So if it was possible for them to possibly have their nursing school be revoked as an accredited university. So that's something that I'm still following. And there's lots of opportunities for queer health in a whole number of areas, like PrEP just the past couple months got listed in the drugs formulary in Newfoundland. So it's great because I was sending a lot of angry emails and finally the right person heard it and it made a policy change. My research is based on some stuff that the Canadian Rainbow Health Initiative did years ago with Jens Hellquist. There was an environmental scan, summary of findings, and it was really basic, so I expanded on that. There's some more information there on it, but it doesn't really matter as much, and we can talk about it more anytime. So this is essentially my methodology, my theoretical framework. So I think it's really important for policy action to be community building and education. While there are quicker routes to policy change, as an outsider, because I have no background in nursing whatsoever, it's really important to reiterate information that's already out there and translate it into information that's easily digestible by the nurses, I guess, in this case, nurse educators, those with the power to do the actual work. So always amplify messages, translate them to do knowledge sharing so that we can keep trying to eliminate institutionalized heterosexism and cisgenderism. So my actual thesis, I got 17 English language institutions across Canada. The directors of the schools of nursing filled out the survey. I identified that there were 76 at the time, but a lot of those were actually non-accredited universities. Then I also did critical document analysis of 52 entry to practice documents. Came up with 16 pages of comments, and it was all based on 23 questions that the administrators answered, none of which were willing to share their actual curriculum resources. And scaffolding is really important for developing a research project because you can take qualitative and quantitative data and mix it together to enrich the results so that people can actually utilize it a bit more. So I've got a journal article that might come out in Quality Advancement in Nursing Education. So my thesis, I'm really critical of the Canadian Nursing Association for their lack of policy direction in the area. And Quality Advancement in Nursing Education has agreed to publish it. And they're the journal from the Canadian Nursing Association. So it's really good that they're being open to this criticism that I'm giving them. So from the survey, the results, there was a whole bunch of variability. So some institutions had a lot of information. Most institutions didn't have very much. It was either one course, possibly an elective, and it might even be LBGTIQ2S health and wellness issues were maybe mentioned in one lecture. So because of that, there's a whole lot of opportunity, and it's definitely left up to each institution the need to do a broad-based analysis of their curriculum to do a queer lens analysis to see what's being taught, how it's being taught, if the information is up to date, because prep is available now. And then change curriculum to be more inclusive so that the educators are teaching the next level of nurses who then provide care to people like us who may not necessarily get good quality health care. So for anyone who does community-based work, there was reported a lot of opportunities where the schools of nursing don't have clinical placement opportunities with LBGTIQ2I organizations. So if anyone needs to, they can connect with the School of Nursing and take nursing students as free labor. They also really want to do a lot more collaboration in all research. So if anyone's doing any community-based research, then you can definitely get a hold of schools of nursing, put a call out to them, because they should be more involved in these things. And it's a way to help build in alliances and improve the curriculum as well as the work that's being done. And like I said, curriculum evaluation and resource sharing. Curriculum evaluation can be done within nursing institutions and resource sharing between the organizations. Because the majority of the respondents, they were busy educators. They're not willing to and not knowledgeable enough to include content. And also there's an explosion of recent information. Also, nurses aren't necessarily known for their policy engagement. So for community-based organizations to get involved more is, I think, beneficial to them. It's the curriculum that they were teaching was often left up to the instructor, and yeah, they didn't really consider the policy approach. So from the actual survey results, which was a small portion of the whole project so far. So minimal inclusion was stuff that was probably not in the curriculum or might be there a bit. Things such as coming out and coming to terms wasn't really addressed in curriculum. Sex reassignment therapy, issues of intersex, transitioning, gender expression, and barriers to accessing medical care for LBGTQ2I people. And then the confirmed inclusion, they rated it, so these are issues that they do have enough that they're teaching on it. Whether or not it's queer is a different story. It's just whether or not it's there. So unhealthy relationships, partner violence generally, general problematic tobacco, drug, and alcohol use, adolescent sexual health. They definitely teach about HIV, STIs, safer sex generally, and body image generally. This list was what I came up with after doing research into what the actual phenomenological health issues faced by LBGT people are. And then curiously, half of them reported that it was really high in the curriculum and half reported that there was none in the curriculum at all. Chronic diseases relevant to LBGT populations. And if you think about it, chronic diseases affect everyone, but they haven't yet understood to frame it in, to be able to target the information that certain populations, such as the LBGT people, have more adverse effects to it. So the research that I did is similar to Canadian and US medical work that's been done. So essentially, I just did this investigation, and then between doing it, there was another journal article that published essentially the same results. So they looked at US nursing curriculum, and it's the exact same thing. So it's really interesting to know that my work was actually like verified by someone who actually, I don't know, they had a huge population, whereas mine was just like 17 nursing educators. So that's it for my thesis. Then I applied for the CIHR Design Jam, which is a CIHR-funded policy thing. Got some money, started doing some work on it, and then I was linked up with these two other people, Jen Carroll and Aaron Ziegler. The three of us are now, we've got a $75,000 grant to develop a website for mid-career nurses to improve their knowledge, skills, attitudes, education, essentially, for LBGTIQ health and wellness issues. So the website's gonna have toolkits, videos, fact sheets, self-testing. It's gonna be done so that they can print out a continual professional development certificate for hours. And then we've contracted Queen's University to develop it because they're nurses with expertise in curriculum. And hopefully it'll be really good. We had another teleconference on it the other day. So it's going to address issues such as heteronormativity, cisgenderism, provide information about health and wellness. There'll be audit tools, so if anyone wants to audit their university curriculum, then they can. Rainbow Health Ontario has decided to come on board as well. So it's going to be a national thing. And so February was when we got the grant money, and then started meeting with the team in October. We're hoping in January to actually have the basic outline so we can start testing it. And then the CIHR grant has to be spent within 2 years max. So it might be later than March 2019, but sometime within the next year, there's going to be a national launch of a online educational module for nurses to improve their knowledge, attitude, skills about LBGT health and wellness, which was weird that it came out of my thesis and I got money to do it, and I'm also here now talking about it because it was just something that was really interesting. And then some references. The easiest thing is just send me an email and I will share all of that stuff with you. Questions and comments?